This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, there we go. So I got 24 slides. I'll breeze through these real quick. So there's time for questions. So the first part, we're just going to go through like some of our rotations. So there is 2 PGY1 spots. These are our PGY1s last year. They're actually now PGY2s, but so for our PGY1 year, there's 2 out of the 5 or 4 spots per year. I wish we had room for everyone to do a categorical program, but there's only 2 spots. It's really great. There's internal medicine, which is typically with the hospitalist service, so it's a little bit different than most teaching services. You are on a 1-to-1 ratio with the attending. It's a great learning experience. It's, again, probably I did the intern year here, is probably one of the best intern year experiences I could ever imagine. Neurology, you do 2 months with, typically it's on the stroke service, as well as consults, and you'll see a lot of things. It's a big tertiary academic center, so you see a lot of people being flown in and transported in with very interesting etiology and different kind of things you'll learn. 1 month is with neuromuscle. You could actually do some, well, you could observe some EMGs. You're not really doing them at a PGY1 level, but you could observe quite a few, which gives you a little bit of a head start into your PGY 2 through 4 year. Rheumatology is great. They do a lot of ultrasound with our rheumatology group here, which is nice. And then radiology, my year was COVID, so it was all Zoom-based reading, but prior to my year of intern year, they were actually allowing people to come do procedures as well in the radiology suite. And then we do 1 year in the traumatic brain or spinal cord injury unit to kind of get you, this is near the end of your PGY1 year, to kind of get you comfortable with the PM&R side of things. And then PGY 2 through 4 years, we've got a good mix of different things. We've got, for our inpatient, we're at a facility called the Rehab Institute of St. Louis. It's a shared adventure with Encompass Health. We do a spinal cord injury unit rotation. We have a brain and stroke, we call it TBI and stroke. And then we'd have now have a general inpatient as well as a polytrauma. I think that's later in these slides. There is some VA rotations at a place called Jefferson Barracks. Here in St. Louis, we actually have 2 VA hospitals. One is called John Cochrane. We don't really spend much time there. Sorry, my slides are advancing without me doing anything. But and then we have a consult service, and as well as we have a very robust outpatient MSK pain, orthotics and prosthetics. A lot of our electrodiagnostic testing is done with our musculoskeletal rotations, as well as with neurology if elected. Here's a picture of our rehab unit. Again, it is kind of a joint venture with Encompass Health and our main hospital system called BJC Healthcare. We have 96 beds here. Currently, it's a mix between the Washington University physicians and private, so we don't cover all 96 beds. We probably do a little more than half of the 96, probably between 40 and 60. All right, so we have our brain is one of our main inpatient rotations. Again, we see strokes, brain tumors, traumatic brain injury. A lot of these people come from our consult service, so it's kind of like a handoff from the Barnes Jewish Hospital. We have a structured care unit. Right now we have 3 different attendings that kind of rotate. Two of them are neurology trained, which is unique. And then one of them is physiatry trained. They kind of all have their own interests. Some are more interested in stroke, some are more interested in traumatic brain injury. They're all really good teachers. For our our spinal cord injury and amputee service, again, that's at the Rehab Institute. We currently have two that kind of rotate, two attendings that rotate back and forth and covering this service. We see a pretty wide variety of etiology. Again, Barnes-Jewish Hospital is a very, very large academic tertiary medical center. So there's really nothing you won't see here. And then this is kind of newer. We have now a polytrauma unit by popular demand. So a few of the attendings here are kind of newer, and they were able to get this new service off the ground so that we can have more experience with a kind of a more broad variety of inpatients. We were all really good at brain and really good at spinal cord injury, but I think we were lacking a little bit in this kind of medically complex and polytrauma. So now we've got that going starting last year. And it's currently an elective for residents. We have a consult service. It's a very robust service. This is Dr. Boving. There's actually Dr. Doyle also covers the consult service, and Dr. Husky. But it again is a pretty lively service. Currently, I have one resident on at the consult service with the attending. At the VA, again, it's called Jefferson Barracks. It's kind of not too far from the main VA hospital called John Cochrane, but it's kind of a nicer facility. It's really mostly just for certain niches in the VA system, and the spinal cord injury and the general service are two of those services. As you can see, you know, they have a lot of amenities at the VA, which is probably typical with most VA facilities. There's just a lot more funding for these kind of things. There's an indoor bowling rink with adaptive equipment. There's a pool that they go kayaking in. The residents are more than allowed to do all these things with the patients. Some residents do, some don't. It's kind of up to you. And then our spinal cord injury service at the VA is very, very good training. So Dr. Tam here and Dr. Stenson are very good at their job, and they're really experts in the field. And we are very fortunate to have this rotation. The VA, as most places are, it allows a little bit of a slower pace to really focus on learning principles, which is nice. The census is a little bit lower than your private hospitals, so you have more time with patients. And then our pediatrics rotation, we have two pediatric rotations. One of them is here on the main campus. You do just a conglomeration of all sorts of things. So we had two, Dr. Smith and Dr. Levin. Dr. Levin's actually going now to the University of Washington. So Dr. Smith is still here, and then I think they're going to hire someone to replace Dr. Levin, but it's kind of all a big grab bag of everything. There's not like one thing they don't do. Rankin Jordan is a kind of a pediatric bridge hospital. It's in the St. Louis area, and it's a place called Maryland Heights, about 20 minutes from campus, not too far. I'm actually rotating here next month. And so I don't really know a lot about it, other than a lot of it is kind of people that are going to stay a little bit longer inpatient. The goal is obviously to get them home long-term, but a lot of the kids are on vents or more severely affected rehab diagnoses. We have neuro rehab clinics. These are on the main campus mostly, where they do a lot of Botox procedures, as well as they do pump refills for baclofen pumps. They do a lot of wheelchair clinics. They have a cerebral palsy clinic, and then there is a lot of amputee care at those as well. Our electrodiagnostic testing right now is done with the musculoskeletal clinics, and then there's a EMG rotation that's separate from that, but a lot of it is kind of like more musculoskeletal based. We do see some more kind of neuromuscle stuff, but that's less common. Again, a lot of it is sent from the surgeons at WashU. There's a lot of really good cases because, a lot of these patients come from a pretty wide area, and it's pretty, like I said, you'll see a lot of things on the EMG rotation that the surgeons will send. We're pretty fortunate because we have a good relationship with our pain colleagues in the anesthesia department. They regularly will match a lot of our residents from our program. And so, in fact, this year, there's 2 residents that were PGY4s last year that are fellows there, 2 of their 4. So that was a good representation. And they love having us over there. We regularly have at least 1 a month. Sometimes we double up on residents over there. It's a very educational experience. It's like they don't really need us there, but they are glad to have us, and they really let us jump in on procedures pretty much from the start. Our MSK, we have 4 MSK elective rotations here, A through D. They all kind of have a different focus. One is kind of a wide variety. MSK-A, MSK-B is a lot of, well, I guess they all have variety. They're just with different doctors that have, more fluoro or more ultrasound or more EMG or more clinic. It's pretty robust. And so that's kind of one of our residents' favorites is the MSK clinic here. There is opportunity for sports medicine. Every year we've had a sports medicine. 2 or 3 years ago, we had actually like 2 ACGME sports med fellows come from our program. So we do a lot of Washington University sports. I think they're D3, and then Lindenwood's a D1. And we do a little bit of what's called an orthopedic injury clinic, which is an acute clinic, kind of like an ER, but it's just for acute orthopedic injuries. And then, yeah, so we have a sports fellow, ACGME, and then a interventional spine and musculoskeletal medicine, a NASS affiliated fellow, and they're more than happy to have residents rotate with them when they or go out on sports coverage with them. Some more pictures of, we do a lot of didactics with ultrasound training. We do a lot of procedural training. We have actually a fluoro course coming up in August. Our didactics follows an 18-month schedule, so you get everything twice when you're here as a resident, PGY 2 through 4, which is nice for repetition. And the first time you hear it, it may be confusing. Hopefully by the second time you hear it, you feel more comfortable. We've got a lot of opportunities for research. WashU is a pretty big research institution, and so they will do anything to support research in terms of funding, in terms of statisticians, and the library is really great. They will do all they can to support you with research if that's your passion. And then we have a few resident-led things like journal club, case conference, and then your PGY4, you do a resident seminar. It's like I'm hitting about 12 minutes, so I'm going to breeze through the rest of this so we can have time for questions. I already mentioned lots of research opportunities. You can either jump on with current research projects that are going on with attendings that need help, or if you are very into research, you can start your own original research, and there's opportunity to get funding with different grants, and we have lots of support. So we actually had an MD PhD last year that graduated and had a lot of projects going. He's got his own lab at WashU now, and he's currently a pain fellow. All right, so we're in St. Louis, right in the middle of the country, easy to get around anywhere you want to travel in the US. It's really central, Southwest. They don't do hubs, but it's essentially kind of a hub for Southwest. They have a full terminal to themselves, and you can really get anywhere you want on Southwest in the US, that is. And then, yeah, a lot of great things. Forest Park is right next to the campus here, and that's a resident favorite. A lot of residents live in Central West End by campus because Forest Park is a quick walk away. We've got a zoo that's free. They've got an outdoor theater called the Muni that's free. Well, the tickets in the last 9 rows are free, but you can also pay for tickets to get closer. Art Hill is a favorite for sledding in the winter. There's ice rink downtown, or actually that's Central West End right there. They do an annual balloon or blimp fest, which is a popular thing. Yeah, and then I think, if I can say anything about this slide, is there's a lot of camaraderie between the residents. Everyone's really friendly. everyone's more than happy to help out with coverage, with projects, with making you familiar. About half the residents are married, and about half of those have children. The other half are not, and either way, everyone's really friendly and collegial. And yeah, this looks like there's plenty of opportunity for different things. This is we do a lot of adaptive and community sporting events. These, you can see the skiing one, that's my favorite. I do that. So yeah, I'll wrap it up there. It looks like we've got just a few minutes for questions.
Yeah, you're at about 5 minutes. You're good.
Okay. So yeah, ask any questions again. I'm sorry, my program director couldn't be here, or associate program director. And so any question I can answer, I will. But yeah. Looks like I got chat box. Let's see here. Oh, this is just, okay. Is there a dedicated ultrasound curriculum? Okay, so yes, it's built into our MSK. We have 12 weeks of MSK didactics, and Dr. Olafson, who is kind of in charge of that, he actually loves ultrasound, and so that's a passion of his. So they do, while we're in that, we will bring all the machines from all the various sites and go over kind of a basics of ultrasound. And then last year in April, we actually had another day where they excused the residents from their entire day of clinical duties to do an ultrasound course. And that was really awesome. It was free for residents. And they brought in a lot of kind of, not only in-house, but we zoomed in a lot of experts in the field to talk about ultrasound. Typically it was like a half-hour quick didactic, and then we'd practice for a half hour. And then we did that for almost 6 hours, and then included breakfast and lunch. It was awesome. So that was actually new last year, but so typically twice a year. And then for people that want extra training with ultrasound, each site has one. Residents have free use to get one, or to go practice, as long as none of the attendings are using it. So typically, if there's 2 residents of the VA, in the downtime, they'll go and scan each other, especially with the 4s, as we're kind of getting further along. And then the fluoro course is new this year. I'm kind of coordinating that. We got 2 models. They were pretty expensive, but ortho is our department, and they were happy to pay for them. And so we're doing a fluoro course this August. My hope is to continue to do that every year. I mean, that's the plan, because the models were like 10 grand. So obviously we're planning on using them for the next 5 years while they're in warranty. So that's kind of a fun thing that's unique here as well. All right, we got like 1 minute. Any last minute questions in the chat, or you can unmute either way. Graduates. Okay, so we have a really wide variety of graduates. So I'm just going to go over one by one. So this year, me and one of my colleagues is doing the interventional spine and musculoskeletal medicine that's NAS affiliated, or NAS recognized, excuse me. One is doing an ACGME sports, one is doing peds, one is doing inpatient rehab. Last year, 2 did pain management or interventional pain and the ACGME, 1 did, and then 2 did the NAS interventional spine, and then 1 did inpatient rehab. The year before that, 1 did inpatient rehab. No, sorry, 2 did inpatient rehab, 1 did ACGME sports, and 1 did the NAS. So pretty wide variety. That seems to be pretty typical if you go back even further. And then they end up going all over the country. We typically will try and keep our own if people are interested in staying in St. Louis, but people go all over. Yes, I will drop my email in the chat. If you have questions, let me know. And then Donna is on our website. She's the coordinator. If you have any questions for Donna, you can also reach out, but I'm more than happy to answer. I'll give you the honest answer. Again, there's nothing in this for me. I think this program is the best, but that's my opinion. All right. Oh, sorry, that was a direct message. Let me All right, I'm going to put my email in the chat box. Feel free to ask any other questions. I think my time is up here.
Yeah, you're at about 30 seconds.
Oh, perfect. All right, if anyone has one last question at 30 seconds, I want to be respectful to the other programs. But obviously you can email me. I've been emailing fellows as I apply to fellowships, and they've been very good about getting back to me, and I'll try and return the favor to you as an applicant. And I will be, again, I'll be honest. I'll tell you the good, the bad, the ugly. I don't think there's a lot of ugly here, but I will be honest.
Thanks so much, Dr. Wright. Appreciate it.
Yep.